Hello everyone, it's Dr. Cynthia J. Hickman, your proactive caregiver advocate. Our topic today is paying attention, because if you don't, it may be costly. Have you heard this saying, hindsight is 2020? The use of the term is associated with decisions and choices, or the lack of, that seem obvious after looking back and revisiting an unsettling outcome. It is the voice in our head that shares how we could have predetermined a situation or consequence. The more you pay attention as a caregiver, the more you will heighten your awareness and revamp your daily movements necessary to continue to accomplish your obligations. Paying attention requires an intentional action of self-awareness, but realize 1 second or 1 minute can change everything. In the caregiving space, we care for our loved ones. We never want to purposefully inflict harm or injury by our actions. Securing what we know and when to use it must be encoded in our daily mission of providing compassionate care. Now, this is not to say when we do everything right and something happens that our most authentic objectives were not genuine. As your proactive caregiver advocate, my passion and goal is to educate and inform so that you will use forethought in the first behaviors versus the last. As humans, we know we're not perfect. Let's start there. But I do believe that whatever profession, career you decide upon, you should never work a day in your life. The current pandemic has shown us the love of a profession, nursing, which is mine. In the midst of everything going on, giving our all should always be our aspiration. Why? Because others are counting on us, and we need to continue to provide quality care. Remember, if your loved one could, they would. So how do we avoid hindsight 2020? To sidestep hindsight 2020, what are some things we can do as caregivers to limit harm or injury? Let's talk about the skin. The skin is a major area that should be on our radar as caregivers. The skin of elderly are very fragile. Because the skin is the largest organ outside of our body, it trumps the most attention. Visual inspection of our care recipient's skin can give you a lot of information, from poor perfusion to nutritional deficiencies to dehydration to cancerous lesions. A real occurrence in elderly are the cubullus, also called pressure sores. They also occur over bony prominences like your tailbone, elbows, hip bones, and heels. These are the most universal areas seen when pressure sores develop. They are quite preventable if you pay attention to the skin. If your loved one uses a wheelchair or is bedridden, please pay attention to their skin. Once a bed sore happens, it can sometimes become very hard to heal, especially if incontinence is a problem. There are 4 stages to pressure sores. We won't talk about them now, but just know that we have to work really hard to avoid them. So in order to not deal with hindsight 2020, have your loved one or whoever you're caring for move about, change positions. If they're bedbound, then you have to turn them. Every 2 hours is what we do in nursing. Use cushions and chairs on elbows, heel protectors, and bed pillows to help with skin protection. There are many different cushions out there, so make your selection based on your care recipient. Keep in mind, comfort should always be. I have used them all at some point. Remember, skin is very important and your responsibility as a caregiver. Keep skin intact and everything will be great. As your proactive caregiver advocate, I know you'll do your best. Why? Because caregivers, you rock.